What a beautiful sea of red. Welcome, nurses, to San Francisco, to my assembly district. And you know, I'll take a bridge to healthcare over a bridge to nowhere any day. And thanks, but no thanks, Governor. We won't take your veto of SB 840. Because with your veto or not, we will continue our advocacy on behalf of the 7 million and growing, nearly 47 million Americans who are without health care coverage and need it, as you have heard these very touching stories already. It is outrageous what is going on, and SB 840 will change that finally in California. So thank you for all of your advocacy and your strength and your passion, for your compassion, and those of you who have come from out of state, thank you for your sales tax dollars. We need this to balance our local budget, and we hope you'll do some shopping while you're here. But you all know how serious the situation is, and I make reference to a study and report issued by the Lucille Packard Hospital Foundation just last year. They took a look at healthcare in the 21 top industrialized nations. They looked at access to healthcare, cost of healthcare, healthcare outcomes, life expectancy rates, infant mortality rates, and guess what? The United States ranked at the bottom 21 nations out of 21 nations. And of course, we're paying twice per capita to rank the worst of the worst. Now, interestingly, the other thing these other 20 nations have in common, not with us, but with each other, is some form of single-payer health care reform. And that's what we're fighting for. I've been a proud principal co-author of Sheila Kuehl's bill these past many years, and it will be my honor and pleasure to be the author of SB 840, succeeding Sheila in her great successes. But we've got to do it together. We've got to do it together. You know, even if we had a governor, and we will make sure we elect a Democratic governor in 2010 who will sign our bill into law, but that's not the end of the fight, because we know the health insurance industry will gather the signatures. You know, we've got this crazy initiative and referendum process, sometimes to our advantage, sometimes not, here in California, and we know we will have to fight the industry at the ballot. The voters will get the last say here in California, no matter what. So we need to use every day, every week, every month until we get to that ballot, which could be some years away, to continue to educate Californians, raise their consciousness, help them understand what single payer means. We know this is not, quote, socialized medicine. Healthcare provided in the private sector stays in the private sector. Healthcare provided in the public sector stays in the public sector. We're just talking about a single administrative arm rather than the thousands of payers that exist in California today. We cut out the 33% we are wasting currently of our healthcare dollar, not on healthcare provision, that is currently wasted on healthcare administration, and put it into patient care. And that is what single payer is about, and that's what Californians need to understand. So I support not only the California Nurses Association, but the NNOC in your nationwide effort. So very, very important. You know, when I read of the Kentucky River decision, realizing that we needed a state law here in California to codify nurses' rights to form and join unions on behalf of collective patient care, because nurses aren't advocating for their hospital employers. They're advocating, as you so well know and do on a daily basis, for the care of your patients. And that's as it should be, and you should be able to have legal statute to form and join those unions. So thank you again for all of your doings, all of your strength. We can and we will do this because the need is so great and the suffering grows on a daily basis. Bless your hearts. Thank you for being here and for being so strong. And let's elect Barack Obama president this November.